COVID-19 is surging in the United States, an 85% increase in just 2 weeks. In this Inside the Americas, Doug Herbert will be on hand to talk to us about why wearing a mask is so controversial in the U.S. We'll also see the toll coronavirus is having on America's healthcare system. And the Democrats are running a presidential campaign with their candidate in confinement. Our correspondent tells us about the effect COVID's having on Joe Biden's campaign. I'm Jeannie Godula. Almost 3 million Americans have been infected with COVID-19, the most of any country in the world. Here's a look at just how the virus has spread in the U.S. since it was first flagged 6 months ago.
The first known case of COVID-19 in the U.S. was identified on January 20th in a Washington state resident recently returned from Wuhan, China. Through February, as U.S. cases rose to 88, the main epicenter was still the Seattle area, where what was believed to be the nation's first COVID-19 death was reported on February 29th. By the end of March, the virus was in all 50 states. As lockdowns were imposed, known cases hit over 140,000, more than any other country. Over 1,000 Americans had now died from the virus. April revealed New York as the new epicenter of the U.S. outbreak. By mid-month, the state had some 160,000 cases. Deaths in New York City alone topped 16,000. By the end of May, more than 100,000 Americans would be dead from COVID-19, among some 1.6 million known cases. But with rates trending downward, hope grew that the outbreak would soon be under control.
Open California!
Instead, the virus regained momentum in June, its epicenters shifting as states reopened. While cases in New York declined, other areas began to spike, particularly in the South and West. July has so far set an increasingly grim picture. While other countries with stricter, longer lockdowns have seen their rates continue to decline, the U.S. curve is climbing. The country is setting new infection records almost daily, 250,000 new cases in the first 5 days of the month alone.
Many people outside the United States have a hard time understanding just why America has been so slow to try and stop the spread of coronavirus. Well, to try and explain that a bit more with me, I'm joined on the set by France 24's Doug Herbert. Doug, for so many countries around the world, wearing a mask is just a given. It's straightforward, it's smart, but it doesn't seem to be that way in the United States. You could almost say that the country seems to be split along two lines. Those who don't wear masks are Trump supporters. Those who do are Biden supporters. Is it really that simple?
It's almost that simple. Obviously, there are many exceptions. But in general, the non-mask wearers do tend to follow their leader, Donald Trump, who has been signally out there not wearing a mask, with very rare exception. He just doesn't wear one. He sees it as making him look foolish. A lot of him and his supporters see it perhaps as a sign of weakness, even submission. Masks, you're right, have become a real political act, almost a hostile act for certain people in the United States. So if I go into a shop in the U.S. wearing this, right? If I wear this, I will actually, in some places, be refused entry. This is actually seen as a belligerent gesture. For those who don't wear masks, it's very simple. They see it as a question of individual freedom, their freedom to make their own choices, to do what they want with their own bodies. And interestingly, you know how socialism, we talk about that a lot? People who wear masks, a government that tells you what to do, including wearing a mask amidst an outbreak, that's communism. That's why, perhaps, it's become violent sometimes. A guard in a supermarket in Michigan was actually killed by a client because the guard asked the client to put on a mask before they walked into the store.
And to make things even more complicated, it seems that each state and even some individual cities have their own policies when it comes to telling people what to do.
Yeah, America does have a decentralized political system of government. We know that states can have their own policies, but generally there's a framework. There's a federal government, Washington, D.C., a guideline. You haven't had that here. There has been a total, and I can use the word total, absence of coordination, of cooperation between the White House and states, but even within states and counties and cities. And you have a lot of situations with, say, Republican governors of states, often pro-Trump governors. Take the state of Texas with Greg Abbott. He's been in this weird balancing act between, his state seeing a surge in these COVID cases. He's trying to fight fight the virus. And at the same time, he's also trying to fight the extreme right wing of his own party, who see him as a traitor. Why? Because in one case, he said he allowed companies to force their employees to wear masks. That was seen as being a traitor to the cause of American individual liberties. But it just shows in these cultural wars how fractured it's become. And not even a pandemic can put the brakes on these cultural tug of wars. And I'll just end with this one thing. Dick Cheney, former vice president under George W. Bush, Republican, a staunch Republican, if ever there was one, his daughter, Liz Cheney, actually tweeted, I'm going to end by showing you this tweet. Look at that. That's Dick Cheney wearing a mask and a cowboy hat, okay? And what she did is real men wear masks. That was her hashtag, okay? That is the message she's sending. So not all Republicans, it is simplistic to say all Republicans are against masks, all Democrats are for them. There are nuances here. And Liz Cheney sending a shot across the bow to a lot of the Republican establishment and to Donald Trump.
Just a word on the presidential campaign. Joe Biden has made a point of wearing a mask in public. Donald Trump, not so much. Is that a campaign strategy by Joe Biden?
Yes, it's a strategy, and it's almost an explicit strategy. Joe Biden has made the absolute articulated position that whatever Donald Trump does in managing this crisis is mismanagement. I'm going to do the exact opposite of Donald Trump. Donald Trump is, in Biden's view, jeopardizing the health of Americans, national security, his entire country. Joe Biden, in his first appearance, when he finally came out of confinement after 2 months recently, was wearing a black mask. He wears a mask because he wants to send a message of responsibility, common sense. This isn't a political act wearing a mask. It is a matter of saving lives. That's his campaign message going forward. He's going to be hardwired on it.
Doug, thank you so much. France 24's Doug Herbert. It's not just mask wearing that's playing its part in the upcoming election this November. The surge in COVID-19 is affecting every part of the race. Our correspondent, Ketavan Gorjestani, has more now on the difficulties of campaigning during a pandemic.
A disgusting rat and rodent-infested mess. That's how Donald Trump described parts of Baltimore last summer. For Ben Fleury, vice president of the Baltimore Young Democrats, making sure Trump loses in November is job one. But the coronavirus has forced his group to rethink how they campaign.
Even if things were to calm down, most people probably wouldn't be comfortable with a stranger coming to their door and, knocking and talking with them.
For those involved in the campaign, this means doubling down on other means of communication.
Younger people under, the age of 28 or whatsoever, we can try to call them, email them, text them, and potentially even see if we can find them on Facebook and then friend them.
Republicans, on the other hand, haven't given up on traditional in-person rallies. But last month in Oklahoma, Donald Trump's first rally in months had a very disappointing turnout. Young social media users claimed they had tricked the Trump campaign into setting high expectations by booking tens of thousands of tickets and then not showing up. Maryland State Senator Jim Rosapepe, a longtime supporter of Joe Biden, believes the cancellation of in-person campaigning and traditional rallies could actually turn out to be a good thing for the former vice president.
Most people weren't going to meet Joe Biden in person. And so in a funny way, I would argue, I don't know what the vice president thinks about this, but I would argue that it has some advantages because it makes it easier for people in different parts of the country to be in closer communication with him. Technology changes, but people don't.
In August, there will be no packed arena for the Democratic National Convention, which will largely take place online and on TV, with delegates urged to vote remotely. This largely virtual campaign is expected to last all the way till the November vote.
For its most unfortunate victims, the coronavirus is truly a question of life or death. But for those who end up in hospital, it's also a financial issue. And in America, that all depends on what health insurance you have. The U.S. government has stepped in with an aid package for those without cover, but the insurance industry says treatment for COVID-19 patients could top $500 billion, and it's asking Congress to dig deeper. Olivia Salazar-Winspear tells us more.
$1.1 million just to stay alive. That's what Michael Floor was billed for the medical care which saved his life when he contracted COVID-19. After a record 62 days in hospital, Floor was convalescing at home when he received the bill. It ran to 181 pages.
I was expecting the sum, but still seeing it in writing was a bit daunting. I know that when I first woke up in the hospital, that's about 5 weeks I was in a coma, and I realized how long I'd been there and how expensive it was going to be. I think I told my wife that she needed to get me out of there because I was just afraid of going bankrupt.
Michael's in the process of checking how much of the cost will be covered by Medicaid and by his private insurance. Indeed, at the end of March, the White House said insurers must cover the cost for testing and treatment, but the system is opaque and incomprehensible to many. IT engineer Andrew Sensini was exempt from some of his hospital costs, but still received a bill in the post.
They told me that certain parts of the bill are eligible for cost sharing, which is their way of saying I have to pay it, and inexplicably other parts of the bill are not, even though all of what I've been billed for is related to COVID-19 testing.
His policy does cover the cost of the coronavirus test itself, but not his stay in the emergency room at $848. He's still negotiating with his insurance company over the rest. 28 million Americans have no health insurance whatsoever. Yet given the scale of the COVID epidemic, in April the government took the unprecedented step of pledging $30 billion to those without a safety net.
Today, I can so proudly announce that hospitals and healthcare providers treating uninsured coronavirus patients will be reimbursed.
But has that been applied? Not entirely. Donald Hutto's experience is a case in point. He had no insurance, but the hospital that carried out his COVID test refused the state payment and billed him for almost $2,000 instead. In fact, hospitals are not obliged to accept government money, and many choose not to take it, doubtful they'll be defrayed for their services.
There is concern that there's not enough money in the fund. We have about 28 million people who are uninsured, and that number is likely to rise. So I think there's a concern that the overall amount is insufficient to meet the need.
Uninsured Americans are much less likely to seek out treatment, a situation that's seen criticism piled upon a system based more on profit margins and less on the business of upholding public health.
That's it for today's show. See you soon for the next Inside the Americas.